the outcome of Tarehe Sita, we want to go away from dispensing drugs only. If I come with my hernia that has been disturbing me for over 10 years and it is operated, the result is instant. If I rescued that baby who was supposed to die because of obstructed labor, the result is instant. So they mobilized very well, and we had a good start in Rukunjiri. What we appreciate with these people here, with the exception of some one health center, is that the staff are very cooperative. Very, very cooperative. And they have always been with us on all these days that we have been with them for the 6 days. Going to the patients, I think there is a very big difference between Kigezi and other places that we have been going for Tarehe Sita. A very, very big difference. People in those places come to pick drugs like they are coming to pick their ration. But in Kigezi, the people you are seeing here are people who are sick. The sick people are the ones who have come. You will not find anybody coming just to pick a drug. That is the difference that we have seen with the people of Kigezi and other places that we have been conducting the Tarehe Sita. So I wish everybody would have that thinking or that perception that you should only go to the hospital when you need to get a service. There are other things that we are also carrying out in all the centers. We are looking at, we have mobile teams, which is having dental, the eye, and there is also cervical cancer screening. You know, we want to ensure that we prevent. If you can detect the cancer early enough and manage, you save a lot of money. If you go to Uganda Cancer Institute, that is when you will appreciate that we need to do preventive. So we are doing that. We are doing HIV screening, and we are also doing health education, because that is a part of the prevention. I think where we need to have input in the subsequent Army weeks, we need to put emphasis now on dental services and eye services. Where we have gone, we have seen so many cases of dental caries. And you know, worldwide, the most commonest ailment in the world is dental decay. Unfortunately, the eye is one of the most expensive. Unless resources are added, almost all the people who are coming, especially the old people, even the young, by the way, they would need spectacles. But those are very expensive. So, but we are giving whatever we have, and so far, so good.
I'm Lieutenant Colonel Dr. Lopez Mukuye. I'm the head of the medical team here in Kabale district. As you are all aware, Kabale has all the trails of the revolutionary struggle. So during the 45 years Tarehe Sita celebration in Kigezi district, as medical we are giving back to the people. So we have 3 teams here, 3 teams of medical. We have static surgical, we have static medical camp, as well as mobile medical camp. So we inserted in Kabale district on 1st December, and by 2nd December we are already at our stations. The static surgical and static medical camps were in Rubaya, Health Center 4, and then the mobile medical team or camp was in Kakomo, Health Center 4. Mobile medical shifted after 3 days to Maziba, Health Center 4, while the static medical and static surgical remained in Rubaya. The people were appreciative, and they are still appreciative of what we are doing. We are giving them back, and we are covering all conditions, medical conditions as well as surgical conditions. Under surgical, we have seen hernias, hydrocele. We have also been presented with the keloids, which we have worked on, lipomas. For the medical conditions, you are well aware in Kabale there's less malaria, but we have seen a lot of respiratory tract infections, UTIs, and we have been able also to help them and ensure that those ones that have been worked on surgically, we are going to come back and review those patients after some time when the whole team has extracted. There's a team that will come back, the surgical team, to review our patients. Today we are here in Kamuchira, static surgical camp as well as static medical camp. The mobile medical team has gone to Butanda, Health Center 3. From Butanda, they will be proceeding to Kaharo and then Buhara, and then we shall complete. We are here for the next 6 days. We shall extract on Saturday. We have specialists that are here with us. On the mobile team, we have eye specialists that are moving from place to place. We have specialists in dental. We're also doing HIV screening. Specialists are there. Cervical cancer screening, TB screening. Those ones are now moving from health center to health center. They are part of the mobile. But then we have also the obs and gynae specialists are here with us. We have got surgeons. They are here, general surgeons. So our team of experts are also on the ground. They are here on the ground, as well as the medical officers.
Amazina ganje baranyeta twino mushino Fred ndiko mucharo cha Bushuro kombe ese na Nigeria soba ahigware yakamutira ndikushasha emibazi yone obugwiro buna ndikushasha banchebera bampereze emibazi yona mazima ba doctor babari kugambaje bakujuma muntu wena so abagwire bona bajyokwe abakwenda obuhereza mazima obuhereza ni burungi nibachebera buri ngwara yona no kushemeza nibashemeza so odyokwe wena oburikirize aisha tungo bujanjabi obuhereza ni burungi
Yema obuhereza obu batuletera hano higwaro ya mugware Center 4 Rubanda district ndasima agwa kugira ngo naisha ndi kushasha ngwere bampa mibazo inandenda ngeno obu mukamaye bale na president wetu waba tuletera nawe bale kubaleta turasima munonga magara getu tureba ngo ari kugafo munonga kugira ngo tutungo bushasha bingene ngo kugira ngo tubone mibazi tugume twina magara maro
amazina ganje ndikirize midwedi daruka mu seru yo mwiguriro umurukanika kole amugasabu county ndasima munonga amahega UPDF abwo kutubuhereza itwa abantu bahagombora jahamugwa twashemereye go munonga bagumize ma abwo buhereza burungi bo batuhereze imibazi twa Jubine bari kutukolera bebare